Hi guys, my name is Sophia and this video is my journey with having COVID. Um, didn't tell a lot of people about this. I told the necessary people, like my immediate family and my job, but I'm here to try to tell people about my journey. Hopefully, it will help some of you with knowing if you have it or not, knowing if you should get tested or not, um, and just kind of give you an idea of um, just a journey from somebody who's had it. First of all, I want to say that the most difficult part of the journey when I received that positive test result was conviction and just I was so upset about the possibility of passing something to somebody that I didn't even know that I had. And so we're going to talk about that. I'm going to share with you my regimen of what I was doing before COVID and what I'm doing now that I'm diagnosed with COVID, and um, and then I'll probably do some type of follow up. I do know that I believe that I'm over the hump. A lot of people who have um, talked to me and checked in with me said that I sound a lot better today. I sound like I have more life in me today. My son talked to me over the phone and he said the other day, like his heart just ached because of how sick I was sounding over the phone. So, this is my story and I'm sticking with it. No, this is my true story about how COVID just turned my whole life um, upside down. So about a week ago, I was having some cold symptoms, like cold and allergy symptoms. I was having like scratchy throat, um, and and so I went to the doctors. I'm taking care of two cats. I'm allergic to cats, and so I went to the doctors, and I'm thinking, I'm not feeling good. I'm just having some body aches and headache, but I also have fibromyalgia and I have another condition, prolactinoma, which are tumors on the pituitary gland that are developed because of a high level of prolactin. Um, so I had other medical conditions that sort of masked the fact that I could have COVID. The headache, I always have headache because of the tumors. The body pain, I always have body pain because of fibromyalgia. The thing that was different was the scratchy throat. I figured it was like my allergies because when you talk a lot or you wake up and you have allergies or there's a lot of allergens in the air, you wake up and you're kind of hoarse and then after you get moving, it kind of clears up. Well, that's what I was going through about a week ago. And what changed was that I started to have fevers at night, and I would take my temperature with a forehead thermometer, and my temperatures were like 99.3, 99.7. The highest was 100.1. The day that I went to go get tested, my fever was 100.1 with one thermometer, and it was a 99.7 with a different thermometer. I really didn't want to believe the thermometer, so I kept alternating between a mouth temperature and a forehead temporal um, thermometer. When they both started reading the same temperatures, that's when I got really concerned. Um, Another change in my health that made me really concerned was I was sitting in the car getting ready to take my son to school, and I got a really, really sharp pain in my back. Like it just like took my breath away. And he looked at me and he was like, "Are you okay?" And I was like, "Yeah, I'm okay." But again, I just assumed that a lot of this stuff that I was going through was because of my fibromyalgia and my tumors. I had a doctor's appointment that was coming up where I was supposed to get my medicine refilled. So I hadn't been on medication for a while, but also I was not on um, my rescue medication. I didn't have any of that either. So, and that was another thing that I developed. I developed that dry cough. So, so on Wednesday, September 30th, Tuesday night, I made an appointment to go get a rapid COVID test. Wednesday, September 30th, I had a doctor's appointment to get my prescription refilled, and I had an appointment for my COVID test. My doctor called and canceled the appointment, and I went in for my COVID test, and it was terrible. My insurance said that they would cover it. I even got my insurance on the phone. And the place that I went, they would not see me because of the insurance. They kept telling me that my insurance was a Medicaid policy. Then they kept telling me that because it was Obamacare, Obamacare does not cover COVID test. It was embarrassing. I had to tell them that because I purchased my health insurance through the marketplace, I'm eligible for a tax credit, but my premium is still paid every month. Like I pay it every month. So it's not a Medicaid. And I even went as far as having my insurance company on the line to talk to the lady. And she said that she didn't need to speak with my insurance company. She was going by what her billing department was saying. And because I had an Obamacare policy, um, they were not going to cover the COVID test because they were out of network. Um, Even again, my insurance company was like, no, when it comes to COVID, as long as she's there for just COVID and nothing else, then we will cover the test. Um, I was feeling so terrible at the time because I just drove an hour and a half to get to that appointment, and I was feeling horrible. I just went out to my car and looked up some other places, and I left. Um, I was able to find another place closer to my home. I went back home and I found Signature Care Emergency Center. And at Signature Care Emergency Center, they do the rapid same day results. And that's what I needed because I worked around children and I wanted to be responsible. I didn't want to be that person to be at work every day with COVID. Well, you know what? I was that person anyway because for 5 days, COVID does not just show up. You do not just get COVID overnight. I just want to tell people that. The studies say it, everyone says it. You don't get COVID overnight. And then for those people who are exposed to someone with COVID and you go test right away and it's a negative test result, that doesn't clear you either because the COVID doesn't really show up on tests for 5 to 11 days. I had two different medical professionals tell me that, and I researched it on my own. So um, it was about a week exactly from when I was treated for my allergies to when I actually got tested for COVID. So I went to this other clinic. I drove an hour and 25 minutes. I get to this other clinic, and now my head is just pounding, and I'm just feeling terrible. My fever was still at 99. I went inside. They were very nice. They took my information. They took my insurance. They took me in the back, and the nurse was very upfront with me, and she said, "This is what I'm going to do with the test." She said, "I need to get a good swab. I need to tilt your head back so that your nose is sort of like that. And she said, I need to be able to go straight in. It will burn. It may burn a little. It burned. Not a little. It's almost like brain freeze. It was almost like brain freeze, or when you get water in your nose when you're swimming. Um, that it was that type of burn. It wasn't something totally unbearable, but it was uncomfortable. Um, and then she said I didn't get enough of the sample, so I have to do the other side. I was like, ah. But she also said that if I make your eyes water, then that means I got a good sample. That means I hit the back of your nostrils and I got a good sample. Yes, she made me cry. She did get a good sample. So she went out of the room and the doctor came in and he was talking to me. And just before he was getting ready to do a strep test, she walks in the room. It didn't even take 20 minutes. I think it took maybe 12. I don't know. I just know time stopped. My heart stopped. Everything stopped when she said, "You're positive." That was like, that was so hard because I work with kids and I was just thinking, like, who was I around? Was I around my family? How many days have I been walking around sick and not knowing it?